The NCAA and NAIA have made student-athlete mental health a focus in the past few years, creating resources and task forces to respond. Local programs are implementing those, plus creating their own programs and resources to support students.
Number one, creating a position within our administrative staff, our mental health liaison position that lives in our athletic training world. And within that position, it's really just to be a liaison. So if a student athlete is having trouble with their mental health or they're facing a mental health crisis, just having somebody to go to that's going to listen to them. And it's not to be a counselor, it's not to give them mental health advice, it's more so to help guide them to what's going to be best for them.
Of course, education is a huge part of both Rocky and MSU-B's missions. The Jackets are also incorporating mental health services and education into their approach through local sports psychologist Danny Dessen.
The question that a lot of people ask me is, are athletes different now? And I'll pretty much answer yes, because they are in a different environment. We've kind of created sport culture to be a more challenging, more cutthroat, higher pressure situation. And that's creating new problems at younger ages.
Dessen draws partly on his own experiences as a student athlete and works with athletes of all ages to sharpen their mental game. As a society, both Kleeman and Dessen feel we still have a long way to go, but athletics programs are realizing the importance of supporting the whole athlete.
We've now learned over time that, a certified strength and conditioning specialist is an essential thing to have for your athletic program. Lifting weights and working out and improving your body is now essential to performing at a high level and, keeping yourself satisfied in your sport. I would love to see the mental part get to that point as well.
I talk about mental health a lot of times as an endemic. I don't think there is a magic pill that's going to show up and is going to make everybody happy. I mean, I think that it's something that we have to continue to talk about. And again, developing not only the education of when we're heading towards a mental health crisis or we're having struggles, but also looking at from the standpoint, how can we continue to educate, especially our young people.
From Billings, Caitlin McLean, SWX.